The sun looks like it's shining through, so I think it's going to be a good day today. So welcome to another SEBB webinar with Outreach and Training. And thank you for joining today's webinar on limited open enrollment. Again, attendees are muted. So if the system does allow you to unmute yourself, please just put yourself back on mute. We cannot assist you with any technical issues, so we do apologize. Please see your IT department to help you with those. Hopefully everybody can hear us and see the presentation. My name is Rob Lydon. I'm a benefit marketing rep with the Healthcare Authority, and I'll be your host today. Our presenter is Sarah Story. So again, this webinar is being recorded and will be posted to the Benefit Administrator website as all of our presentations. So let's talk about some addressing questions during the webinar. So please use the question feature to send your questions throughout the webinar. We will address some questions throughout the presentation and at the end of the presentation as time allows. So questions that we're not able to answer during the presentation, we will address those through either an email, we'll give you a phone call, or we'll answer that through Fuse. And if you have employee-related questions or scenarios, specifically to your SEBB organization, please send those through Fuse. And if you have urgent matters, please call our 1-800 number at 1-800-700-1555. So let's get started. Sarah?
Thank you, Robert. So good morning, everyone. Happy Wednesday. As Robert said, we will be going over the SEBB limited open enrollment. So we'll get you all the information that you need and hopefully answer all your questions throughout this webinar. Let's go ahead and get started. All right, so first I want to address what this limited open enrollment is and why we're doing it. So in light of the COVID-19 pandemic, the SEBB program is offering an opportunity for employees to make some changes to their 2020 SEBB benefits through the month of July. So July 1st through July 31st, employees will be able to make some changes. So what are those changes that they're able to be made? So changes include employees will be able to enroll in medical coverage, and then also enroll in and make changes to their medical FSA and DCAP. So notice I did not say they're not able to waive medical coverage and they're not able to change their medical plan. So it's enroll in medical coverage and enroll in or make changes to their medical FSA and DCAP. And I'll provide some more details here later on in the presentation. And then all changes that are performed during the limited open enrollment are going to have an effective date of August 1st, 2020. All right, so our agenda, I just went over what the limited open enrollment is. Coming up next, we'll go over some communications that are going to be going out to you, the BAs, as well as staff. We're going to compare what the limited open enrollment is versus a special open enrollment because they sound similar, but they're very different. We'll be going over some changes that can be made in more detail throughout this LOE. What are the responsibilities for you, the BAs? We're going to be covering so much information. I just really wanted to break down what you guys really need to focus on with your responsibilities for this, your resources for the limited open enrollment, and then of course we'll go through and answer some questions towards the end. All right, so some communications. So June 23rd through the 26th, Navia is going to be emailing SEBB employees that have a medical FSA or DCAP account, notifying them that this limited open enrollment is going to be happening. Today, June 24th, HCA is going to be mailing out a limited open enrollment postcard to employees, notifying them of this limited open enrollment opportunity. On June 29th, Outreach and Training is going to send out an It's Here Gov delivery to all BAs. And that Gov delivery is going to include a message that you can forward to your employees that has more information on the limited open enrollment. Then getting into July 1st, HCA and Navia will post the COVID-19 limited open enrollment forms that can be used. So we'll go over more details on those forms later on in this presentation. July 15th, HCA will mail out a reminder postcard to SEBB employees reminding them that this limited open enrollment is happening. July 24th, Outreach and Training is going to send a deadline approaching Gov delivery to all SEBB BAs. And then it's also going to include a forwardable message to allow you to send to all of your employees. And then lastly, July 24th through the 26th, Navia will be sending out a deadline approaching email to all SEBB employees who have a medical FSA or DCAP account. So lots of communications throughout the month of June and July that will be happening. All right, so on June 12th, we went ahead and sent out a Gov delivery notifying the BAs of this limited open enrollment opportunity that's coming up. So that was sent out on June 12th. And then here's a screenshot of that postcard that's going to be going out to employees today. So they should be receiving it here in the next couple days since we're mailing it out. This is the front of the postcard, and then on the back, it has all of the details of the limited open enrollment.
So Sarah, so we do have a question here. We'll get a lot of questions, of course. Can we get something that we can email out sooner than the 29th? So Sarah did say on the previous slide that a Gov delivery was sent out on June 12th, and all employees will get this postcard today. So that is all the information we have as of now. So that Gov delivery should include a lot of information, to include the presentation that you're getting today, which is going to have a lot of information that'll probably answer some of your questions. Okay.
All right. Okay, so let's go ahead and compare what a limited open enrollment or an LOE is compared to a special open enrollment, which is an SOE. So very different. So I just want to make sure that you guys don't get this confused. So a limited open enrollment, it is limited. It's only happening July 1st through July 31st of 2020, and it's in light of that COVID-19 pandemic. There are limited changes that can occur during this limited open enrollment. So remember I said enrollment and medical coverage, or enrollment or changes to a medical FSA or DCAP. So those are the limited changes that can happen. There is no qualifying event proof required. So you're probably used to, typically if an employee lost coverage elsewhere and wanted to enroll into medical coverage, they would need to provide that proof of loss of other coverage, whether it's a letter of some sort. That is not needed. So they're able to do this without a qualifying event.
So Sarah, I do have a question that I want to make sure that it's addressed here. So we do have a question saying, is this only for medical and not for dental or vision? So that is correct. Sarah's going to cover that later on in the presentation, but this is to enroll in medical, to enroll or change your FSA and DCAP. So this is only to enroll in medical. So yes, for your dental and vision, you're going to have to wait till annual open enrollment in October. Okay.
All right. So I'll get into more details about enrolling in medical, but employees are also able to add dependents to medical coverage and get them enrolled. So they would still need to provide that dependent verification document to basically show that this dependent is an eligible dependent. And then comparing it to a special open enrollment. So a special open enrollment can happen anytime throughout the year. There are several different changes that can happen with the SOE. It does require proof of that qualifying event. If you tuned into our previous webinar, I think it was last week or the week before, on special open enrollments, we covered different scenarios as well as referring to that SOE matrix, which is policy 45-2A, and that covers all of the special open enrollment materials with what the different events are, along with what is required to be able to submit the changes. And then again, with the SOE, you also have to provide the dependent verification documents to basically verify that that dependent is eligible. So some similarities, but also very different. All right, so let's go ahead and talk about enrolling into medical coverage. So employees during this limited open enrollment period are able to enroll in medical coverage without a qualifying event. They're also able to add dependents to medical coverage without a qualifying event. And then, as I said before, they must submit dependent verification documents to prove that that dependent is eligible for, to be added onto coverage. And then again, all changes will be effective August 1st of 2020 after the LOE period ends.
So I do have another question here. Is this only for medical and not for dental and vision? So dental and vision, to add your dependents, that's going to have to happen during annual open enrollment. This is only to enroll in medical, or if you want to add dependents to medical. And there's another question here. So this is basically for staff who are currently waiving medical. Yes, so those employees that waive medical and have dental and vision, they now have the opportunity to enroll in medical. Also, if those employees have medical and want to add dependents, they can do that as well. So you can enroll in medical and you can add dependents if you already have a medical plan. This is your opportunity also to add dependents to your medical coverage only, not dental and vision. Okay.
All right. So here's that reminder that he was just saying. So employees must wait until annual open enrollment, which is October 26th through November 23rd of this year, to change medical plans or to waive medical plans, and then to also make changes or enroll dependents to their vision and dental plans. So this limited open enrollment, again, is only to enroll into medical, add dependents to medical, or make changes to their medical FSA or DCAP, which we'll get into the FSA and DCAP later on in this presentation. So in order to enroll into medical coverage or add those dependents to medical coverage, employees should use SEBB My Account to go ahead and do that. Now, we understand that some employees may not have access to SEBB My Account, or there may be some internet issues, anything of that sort. So we did produce a paper form that they're able to fill out as a last case scenario. That form is called SEBB COVID-19 Enrollment/Change Form. This is a new form that we did specifically for this limited open enrollment. And it's only to be used from July 1st through July 31st during the limited open enrollment. And you'll see here in the second orange box that they're only allowing the certain changes for the limited open enrollment. So it's to enroll in medical coverage and to add dependents to medical coverage. So it's taking place of the employee using the SEBB My Account. But again, we recommend an employee using SEBB My Account. Just less room for error and cuts down on the paper.
I have another question here, Sarah. Are you, let's see. So can enrolled employees change medical plans during limited open enrollment? So again, this period is only to enroll in medical, not to change your current medical plan. You have to wait till annual open enrollment to do that. This is only to enroll in medical if you don't have, or if you're not enrolled into a medical plan, or to enroll or change your medical FSA or your DCAP. Okay.
All right. Okay, so as I stated before, the recommended method of enrolling into the medical coverage is an employee using SEBB My Account. Now keep in mind that if an employee uses SEBB My Account to do this change or to enroll or add dependents to their medical coverage, SEBB My Account is not going to allow employees to make multiple changes to their enrollment. So for example, if you have an employee that during last year's open enrollment decided to waive medical, and then they decide during this limited open enrollment that they want to take advantage of this opportunity and get enrolled into medical coverage, but then say they enrolled July 10th, but then July 20th comes around and they say, I actually changed my mind and I don't want to enroll into the medical coverage. Well, SEBB My Account is not going to allow that employee to get into SEBB My Account and basically undo their change and go back to a waived status. So employees who wish to rescind their enrollment that they made during the limited open enrollment will need to fill out the 2020 school employee change form and return it to their BA. So that's our normal 2020 school employee change form that they will need to fill out. Once you, the BAs, receive that form, you must submit a fuse with the employee's completed 2020 school employee change form to have HCA perform this change. So employees and the BAs will not have access to basically undo the employee's enrollment. And then just a reminder that all required forms and dependent verification must be received no later than July 31st of 2020. So that's the deadline for employees to submit any forms of dependent verification, July 31st.
Hey, Sarah.
All right. Yes.
So we are getting a lot of questions on information that Sarah is going to be covering in her presentation. So if you could just hold off a little bit on some of the questions, like where can you find the form? She's going to cover all that. Yeah, just stay tuned throughout the presentation. Okay.
All right. So that 2020 school employee change form, the employee will need to indicate that they are wishing to waive medical coverage or remove their dependent. Now, again, this is not for someone who did not enroll into medical during the limited open enrollment. They cannot go ahead and waive medical. So it's only if they enrolled during the limited open enrollment and they want to rescind their enrollment because they changed their mind during that month of July. And then all changes submitted other than waiving coverage or removing dependents will not be made. And this form can be ordered on the BA website and be given to employees who are needing to rescind their enrollment. Okay, so let's talk about SEBB account. So really quick, before we get started on what the process looks like for employees to log in and enroll using SEBB account during this limited open enrollment, I want to talk about employees who may have trouble logging into SEBB account because they may not have used SEBB account since the open enrollment last year. So if an employee is logged out of their SEBB account, it is up to the BA to disassociate the employee's account. So in order for an BA to be able to disassociate the account, they will need to have this access management checkbox next to their name in the access tab. So very important. You will not be able to disassociate an employee's account and get them unlocked if you do not have this checkbox next to your name. All right, so once you verify that you are able to disassociate the subscriber account, you're going to search for the employee's name who is having troubles logging into SEBB account. You're going to verify that you have the correct employee, and then you're going to check the box next to that employee's name, and then a button's going to appear that says disassociate the subscriber account. You will click that, and what that basically does is it allows the employee to re-log into SEBB account as a brand new user, and it gets them unlocked. And then for more information on covering disassociating a subscriber's account, you can refer to Chapter 2, pages 20 through 21 in the SEBB account manual. Okay, so once the employee is able to get logged in to SEBB account to perform these enrollments, there's going to be an orange banner that appears as pictured here. They're going to need to click the link, the blue link that says make some changes to your coverage. Now, I do want to point out that we pulled this from our testing environment. Excuse me. So you'll see that the dates are June 1st through 30th for an effective date of July 1st. That is incorrect. So the enrollment dates are from July 1st through July 31st with an effective date of August 1st. Once the employee clicks that link to make some changes, it's going to take them to this screen. And it's going to allow them to add dependents if that's what they wish to do. They will need to submit their dependent documentation to verify them as a dependent. They need to make their proper attestations. So the attestations are a spousal surcharge attestation and tobacco surcharge attestation. And then lastly, they will add their medical enrollment if they were not already enrolled in medical. Now, if you have an employee who is not wanting to add dependents, they just simply want to enroll into medical coverage, they would just go straight to the make attestation step, and then they would choose what medical plan they want to go ahead and get enrolled in. All right, so the Healthcare Authority has set up a call center to help employees with SEBB account issues related to the limited open enrollment. So during this period of July 1st through July 31st, they can call this 1-800 number, or the 855-648-3100 number, Monday through Friday. Hours are to be determined. I'm assuming it'll be just normal business hours. And they can actually call that call center and receive help and advice when it comes to using SEBB account for this limited open enrollment period. And stay tuned because there will be a GovDelivery that will be sent out with more details to come on this. Then I also want to notate that July 3rd, they will be closed due to observance of 4th of July, Independence Day. Okay, so now let's get into talking about the FSA and DCAP and the changes in enrollments that can happen there. And then just a reminder that all changes that are performed for the FSA and DCAP are also effective August 1st. So if you have an employee who's currently enrolled in the medical FSA, they are able to decrease their 2020 annual contribution amount to no less than the amount that has already been contributed or the amount that has already been claimed. So no less than either of those amounts. If they're currently enrolled, they can also increase their 2020 annual contribution amount up to the allowed maximum of $2,700 for the rest of the year. And then if you have an employee who is currently not enrolled into the medical FSA, they can take advantage of this limited open enrollment, and they can enroll into the medical FSA for the remainder of the 2020 plan year.
Sarah, we have some questions here. So we did make a last minute change. Again, we're getting information, we're putting it into the slides. They're asking that the contact number for the support center was not in the slides that they received yesterday. It's because we added them this morning as we got that information. And if you or I can remember, Sarah, at the end of this presentation, go back to that slide so they could write that number down. That would be great. Also, a question was, if dependents are already on dental and vision, already verified, do they need to be re-verified to add them to medical? And the answer to that is no. They've already been verified in the system. All you have to do is add them to the medical. Okay.
All right. So let's go over a medical FSA scenario. So you have an employee who elected $2,000 for their medical FSA contribution, and they already have had $900 deducted from their paychecks, and they have not claimed more than $900 in reimbursements. So what can the employee lower their medical FSA contribution down to during this limited open enrollment?
I'm thinking that they can only lower it no less than $900.
Yes. So the employee will not, or will be able to lower the limit no less than $900. Now keep in mind that is the least amount that they would be able to lower their contribution limit to. They can elect to lower it to $1,500 if they would like. So any amount between the $900 and the $2,000 that they originally elected during the annual open enrollment. All right, let's talk about the DCAP. So if an employee is currently enrolled in DCAP, they are able to decrease their annual contribution amount to no less than the amount that has already been contributed or the amount that has already been claimed. So very similar to the medical FSA. They can also increase their annual contribution amount up to the allowed maximum of $5,000. And then of course, if an employee was not already enrolled in DCAP, they can take advantage of this limited open enrollment and they can enroll in DCAP for the remainder of the 2020 plan year. All right, so a DCAP scenario. So we have an employee who originally elected $3,000 for their DCAP election for the year, and they have already had $1,000 deducted from their paychecks. So what can the employee lower their DCAP contribution down to during this limited open enrollment?
So I'm thinking the employee can only lower that down to no less than $1,000 since they've already had $1,000 deducted from their paycheck.
Correct. Yes, so no less than $1,000. And just like the medical FSA, the employee can elect to lower their contribution to $2,000 or $1,500. It's just the least amount they would be able to lower it to is $1,000 since that amount has already been deducted from their paychecks. And then on the flip side, how much could that employee increase their contribution limit to if they wish to do that?
So if they originally elected $3,000 and the max is $5,000, I'm thinking they could increase it an additional $2,000.
Perfect. Yes, so the employee would be able to increase an additional $2,000 to bring them up to that annual maximum contribution limit of $5,000 for the rest of the year. All right, so when it comes to enrolling or making changes to the medical FSA or DCAP, the employees must fill out the SEBB COVID-19 medical FSA and DCAP change form. So that is a new form that can be found on the Navia Benefit Solutions website. And then all completed forms must be returned to BAs no later than July 31st of 2020. So we're not able to accept forms that were received any date past July 31st. We do ask that you please do not tell employees to contact Navia to initiate any new accounts or change annual elections. Again, employees must go through their BA to do this by submitting that SEBB COVID-19 medical FSA and DCAP change form. So here's what that form looks like. It is through Navia. It's a Navia form, and it's very important that on the last page, there is a signature section. Now we need to have the employee make sure that they sign and date, as well as the employer sign and date. The employer signing and dating is basically verifying that you looked over all the information and that it is correct. And then all of the information on how and where to send that form, the completed form to, is also here listed in the gray. And again, that form can be found on the Navia Benefit Solutions website.
Sarah, we are getting some questions on how they can find out what the employees already claim. So I think she covered that in a previous slide, that Navia will contact the benefit administrators if the employee tries to lower their medical FSA or DCAP lower than what they've already claimed. So they will contact the SEBB organizations or the BAs and let them know that the employee is trying to lower their amount lower than what they can.
Yes. Okay, so we talked about what this LOE looks like, what the employees are responsible for, and essentially I want to really break down what you, the BAs, are going to be responsible for during this month of July for the limited open enrollment. So when it comes to the medical plan, I just want to remind you that employees should use SEBB My Account to enroll into medical plan coverage, as well as adding dependents to medical plan coverage. And again, SEBB My Account will not allow employees to make changes to their enrollment. So basically, employees who wish to rescind their enrollment that they made during the limited open enrollment will need to fill out that 2020 school employee change form and return it to the BA. And again, that change form can be ordered on the order materials section of the BA website. And once the BA receives that 2020 school employee change form, you will need to send that form to HCA using Fuse with the employee's information. And then us at HCA, we will go ahead and make that change for the employee. And then for any employees who are submitting that paper form instead of using SEBB My Account, the SEBB COVID-19 enrollment / change form, BAs will need to verify employees are only making the changes allowed during this limited open enrollment. So again, that is enrolling in medical coverage. Keep in mind, employees cannot change medical, dental, or vision plans. They cannot make any changes. They can only enroll into medical coverage. And then that's also adding a dependent to medical coverage. So that's an allowable change that employees are able to do, is adding a dependent to medical coverage. And BAs must verify that dependent verification documentation to verify that that dependent is an eligible dependent.
So we do have a question here. As we know of so far, that the paper form to increase or decrease your medical FSA or DCAP is the only way that the BAs must receive those from the employees.
Yes.
And the deadline is July 31st. So those forms must be received by 11:59 on July 31st, or that will not be effective. They will not be enrolled into those benefits. Okay.
All right, thanks, Robert. Okay, so what are the BA responsibilities when it comes to the medical FSA and DCAP? So all new enrollments and any changes to the medical FSA and DCAP accounts must go through the BAs. When employees submit the completed form, the BAs must check that the employee request falls within the contribution amount and the annual max limits. And as Robert said, Navia will contact BAs if an employee has requested a decrease that is lower than what they have already claimed. We realize that the BAs are not going to necessarily know this information, so Navia will take it upon themselves to contact the BAs if they're not able to perform the change because it is an amount lower than what the employee has already claimed for the year. The BAs must sign and date that form once they receive it. Make the appropriate adjustments to payroll and make requested payroll deduction changes. And then lastly, send the forms to Navia. We recommend weekly. We'd ask that you do not wait until July 31st, the end of the limited open enrollment, to send those completed forms. Navia is really wanting to update these in real time so there's no delay on August 1st when these go into effect. So my recommendation is to maybe set a calendar reminder, maybe every Friday, to make sure that the completed forms that you receive for the week are sent in to Navia.
So there is a question, Sarah, the Navia form. I guess there was a BA that went to the Navia website and it's not showing. Again, those forms will not be available until July 1st. So Navia will not post those forms. Also, the limited open enrollment form with the Healthcare Authority will not be posted until July 1st. So you will see those forms beginning July 1st.
Yes.
Okay.
Okay, so let's go over some resources when it comes to this limited open enrollment. So HCA is designating a special website specifically for this limited open enrollment. So that is going to be at hca.wa.gov/SEBB-OE. And that's going to have all of the information that pertains to the limited open enrollment for SEBB, as well as the form on July 1st once it is posted. And then I also wanted to include a link to the school employee enrollment guide, because you may have some employees who are deciding to enroll into medical, but they don't know what medical plan to enroll into, or they want more information. So that the school employee enrollment guide is really a great resource for them to compare their options when it comes to the medical plan.
Got another question here, Sarah. So the forms, so you do have till 11:59 on July 31st. So since you all as benefit administrators are receiving those forms, it's important that those employees get the forms to you, not Navia, not the Healthcare Authority, by July 31st at 11:59 p.m. Okay.
Okay, and then here is Navia Benefit Solutions, their website. It's seb.naviabenefits.com. And then they also have their customer service number listed. It's 1-800-669-3539. And then they also have a customer service email. It's customerservice@naviabenefits.com. And just a reminder, as Robert, I know he just stated it, but employees should not contact Navia for enrollments or changes. They need to fill out the COVID-19 enrollment change form and turn it into their BA to have the changes made for them.
So we do have a few questions here. So I've been seeing that some BAs did not get the Gov delivery that was sent out on June 12th. And you can go on the BA website and sign up for Gov deliveries under notices. Also, any forms that you need, you can go under forms and documents on the BA website. Everything is available on the BA website for you all. Okay.
All right. Okay, so let's go over some upcoming webinars that are happening. So actually this Friday, June 26th, we're going to be covering retirement, accounting, and billing in a webinar. July 31st, we'll be covering understanding error correction. August 14th, we'll be covering preparing for the upcoming school year. And then coming soon, there's going to be a series of recorded presentations on each special open enrollment event that is coming soon. Again, here's the link to go ahead and get registered. You can also find that link on the BA website under training schedule to get registered for the upcoming webinars. And just a reminder that all of our webinars do start at 10 o'clock.
Okay, so we know we've addressed a lot of questions throughout the webinar, and we're going to still try to answer some before we sign off here. So again, any questions that don't get answered during this webinar, we're going to get back to you as we've always done with our previous webinars through either email, through a phone call, or through a fuse. Any specific questions or scenarios that pertain to your specific SEBB organizations, please send us a fuse on those. And then after the webinar, as participants, you all will receive a follow-up email, which includes a brief survey, and we would love to hear your feedback on how we can improve these webinars for you. So let's see if there's any questions here.
So Robert, while you're doing that, I'm going to go back to that one slide of the call center.
Okay.
So employees or VAs can see the information and jot down that phone number. And then just a reminder, we will be sending out a Gov delivery with more information on this call center and all of the information, but here's that screen for you.
And we apologize, we're putting this information out as we get it. So this was just put out just right before we started the webinar, and we wanted to make sure you all had it. Sarah, could you also show them the slide with the COVID-19 2020 change form?
Yeah. Let me find it really quick.
And that's also in your slides and where it's located at. There should be a link on the bottom there.
Yeah. Yep, here's the link. It's hca.wa.gov/SEBB-OE. Just a reminder that employees should use SEBB My Account. This paper form should be a last resort. So employees should be using SEBB My Account to enroll in medical and to add dependents to their medical coverage using that limited open enrollment button in that orange banner.
Mostly now, since most of us are still working from home or some schools are even closed.
Yeah.
So we want to encourage your employees to use and get familiar with SEBB My Account, because open enrollment's just right around the corner.
And SEBB My Account's going to allow for less room for error. With a paper form, there's always room for error, processing time, all of that type of stuff. So SEBB My Account's going to be the streamlined, preferred, recommended method for employees to take advantage of this limited open enrollment when it comes to enrolling in medical coverage.
Sarah, do you see any other questions that we can answer here? I know there was one about Alex, but I don't want to give an answer on that because we're not even sure about it.
The virtual enrollment?
Alex, the online support tool, support advisor. Yeah, we haven't heard anything about that being available during this period.
Yeah, I don't believe that will be available for the limited open enrollment. I have not heard anything on that.
And again, any questions that we don't answer during the webinar, we will get back with you next week with through email or a phone call or even a fuse to answer all your questions. All right, that concludes our webinar. Thank you all for joining us. And again, you will get a email for a survey. So we would love to hear your feedback on this. And there was a question that numbering the slides, and I know that was brought up last webinar we had. It must have slipped our mind, but on Friday's webinar, we hope that you all join us. For Friday's webinar, we'll make sure that the slides are numbered if you choose to print that. And you covered all the upcoming webinars that we have. Is that right, Sarah? Okay.
Yes.
So our next webinar will be on this Friday starting at 10 o'clock, and that'll be on accounting and retirement. So if you haven't registered, please go to the BA website under training schedule and register for that webinar in a few days. And we'll make sure we number those slides. Okay, I think that's it.
Thank you for participating, everyone. I hope you
Thank
have a good
you all.
rest of your day.
Yeah, and have a great week.